The biggest risk with iontophoresis is people treating themselves with too high currents because they want the results so badly. We know that there has to be ions in the water for the treatment to work. So if the water is not right, iontophoresis will not work. There were a few things that changed with the pulsating current coming into the devices. 90% of the cases you can see up to an 80% sweat reduction. So it's quite effective.
Welcome back to the Sweaty Girl Society podcast. Today I have with me Dr. Sandra. Dr. Sandra is a licensed physician, and she's also the co-founder of Hidroxa. Hidroxa is one of the leading manufacturers of iontophoresis machines. So today we're going to dig into not only her experience with hyperhidrosis from a physician's perspective, but also we're going to dive into some questions that people have on iontophoresis. So welcome, Dr. Sandra.
Thank you, Karina. I'm so glad to be here. So my name is Sandra Eriksson Mirkovic, and I'm a licensed physician, a doctor here in Sweden. And now I mainly work in primary care, but I have a lot of experience from working in dermatology with hyperhidrosis patients as well.
And so, Dr. Sandra, I like to ask all of my guests at the start of each episode if they could share their personal experience with hyperhidrosis, what your experience has been, how that led you to become a physician and to found your company.
Yeah, definitely. So I don't even remember when it started. I guess I was pretty young. A few of my first memories are around the age of 7 or 8. So I think it always followed me around, something like that. In Sweden, we celebrate something called rosacea, where we go in white gowns and sing songs, and we carry a light in our hand, a candle. And I remember one of my earliest memories regarding hyperhidrosis is when I was holding this candle. And, it gets a little hot and you're a little bit nervous and it starts, dripping. And I was afraid I was going to lose, that it was going to fall out of my hand and set everything on fire. So that was quite dramatic to me. So I was really tense. I remember that. It just followed me around, and I talked pretty openly with my parents about it. So especially my mother. I didn't speak with anyone else, but yeah. And we started seeking some medical care, but there was nothing to find at the time. We heard rumors about a doctor who was doing Botox. It was pretty early for that, but she had moved recently, just a few months before we heard about her. She had moved to Norway, so she was no longer in Sweden. So there was nothing basically. And then at that time, I was around, I think I was 15 or something like that. And then I went to med school in Stockholm. And I kept searching for options. It became more and more troublesome. We were wearing the gloves and we were doing the physical examinations, even if it was early at med school, but still. So it's getting more and more of my attention, how can I do this? And then I found a clinic in Uppsala, which is close to Stockholm. And I went there and I got Botox in my hands for the first time. And it was just, so great. My hands were really dry and I was like, okay, this is a new experience for me. I was so happy. And then that doctor, he was just so great, with patients, like a people person, and very much involved in this, very invested in helping hyperhidrosis patients. And so I started working at the clinic during med school, just doing administrative work and whatever I could. But that led me into writing my thesis about children and hyperhidrosis. We were doing a study, like a journal study about children and hyperhidrosis and Botox. And then after that, that became a published article as well. And then I started working with him in his clinic after med school. And I continued working in a few of his clinics and I met, a lot of patients. And at this time, I started hiding behind my role as a doctor. I never talked about my own. I always said, I never mentioned in the beginning that I had hyperhidrosis myself. And then when I became a little bit older, it started, slowing down. It became a little bit more easy for me. And my hyperhidrosis decreased a little bit. And that made it a little bit, more easy to talk about it. But I was surprised that I, had been working with patients for such a long time and treating them and still didn't, really, it was hard still to talk about my own problems. So it was just even recently that I could, say it out loud. Okay, I have this. It's easier now, but I have it.
Yeah, I totally understand that. It took me until I was 40 to be okay to talk about it in public, and it's definitely a journey. There's so much shame and stigma around it, and even though you were treating patients who have it, it's different when it's about you, right? So
Yeah.
I totally get that. Yeah. Okay, and then what led you to start Hidroxa and get
Yeah.
into the Iontophoresis world?
Yeah, so this was 9 years ago, and I was working in a sweat clinic at the time. And as I said, we were mainly doing Botox because Botox, it came out in around the year 2000 and became pretty big. Took over almost all the treatments of hyperhidrosis at the time. It became a trend. And then patients were asking me about, like, what do you know about iontophoresis? What do you think about it? And I had heard the word, but nothing more like that. And I asked this Dr. Carl Swartling, who I was working with, the guy who treated me the first time. And he actually hadn't worked with it either. And he's very experienced. And I was like, okay, maybe this is not a real thing, okay? But he said, okay, you can always look it up, and as a doctor, you don't want to tell your patient, go Google things. You want to be able to provide the answers. So I started reading up about iontophoresis, and I realized, okay, in Germany, in the UK, it's actually a big thing. It's kind of the first line of treatment next to aluminum chloride and some other stuff as well. And they're doing this. So I thought, okay, if they're doing that in these big countries, it must be something, And then I started talking to my brother, who is in online marketing, and to my husband, who is an electrical engineer. We sat down, we had some coffee, and just, talked about this. And we decided, okay, maybe we should, see where this leads, basically.
Yeah, join forces. That's
Yeah.
perfect.
We had a good, base team there in my family. So I thought, let's see what we can do about this. And then we started looking for some manufacturers of iontophoresis devices, and we found one in Germany. And then we basically talked to them, and we started selling the devices in Sweden, basically as a distributor. It surprised us how fast it grew. People were so, desperate in looking for solutions, and we were so happy to help. And that's how it went, basically.
Okay. So you're 9 years into your Hidroxa journey.
Yeah, the
Amazing.
years pass very fast.
Yeah, they do. They for sure do. Interesting. So, for the folks listening, I think there's people at different stages of their journey. Some people have been living with hyperhidrosis for years and have received an official diagnosis, know the name. Other people are just finding out that this weird sweat thing that they have, has a name. It is a medical condition. So can you, I guess, from a physician perspective, provide a bit of an overview of what hyperhidrosis is and how we know or what we know about how it works, because there seems to be a lot of sort of mystery around it.
Yeah. Basically, hyperhidrosis means excessive sweating, basically. And when we're talking about the hyperhidrosis that we usually talk about, we are talking about primary hyperhidrosis, which has no other underlying cause. It's not like a side effect from medications. It's not from your thyroid issues, nothing else. Because there is also secondary hyperhidrosis, which is due to something else, as I said. So, but if we talk about primary hyperhidrosis, in the United States in 2004, they sat down and decided, okay, which criteria shall we look at when we talk about primary hyperhidrosis? And then they said, okay, it should start before the age of 25. It should usually not be occurring during the night, like night sweats. It should be hands, feet, or armpits, and it should last for at least 6 months, and it should be, excessive and troublesome. After that, we've learned a lot. I mean, a lot of people with primary hyperhidrosis do sweat during the night. A lot of people with primary hyperhidrosis do sweat in other locations like the head, the chest, the groin area, the back. So those criteria are not like fully reliable, but at least something around there. It usually starts early, but it could also start, later in life as well. So when I speak about primary hyperhidrosis nowadays, I usually talk about like primary focal, which is like one or a few areas, and then more general, primarily generalized hyperhidrosis, which is usually like the head, chest, back, groin area, like almost all of you, but often not the hands or the feet. And these are the two kinds of hyperhidrosis that we speak about. And we don't know why it occurs. We know that it has a strong hereditary part, like at least 50% of the patients with hyperhidrosis have at least one close relative, like a mother, father, sister, brother, who also has hyperhidrosis. But we don't know exactly what genes are affecting it, and probably there are a lot of different genes affecting this, So they have been doing some research in Uppsala in Sweden, and they have identified some genes that make you not sweat at all, like anhydrosis, it's called. So they're getting closer, but I mean, hyperhidrosis hasn't been very popular to do research on. So far, there's still so much that we need to learn. We don't know all about it yet.
Yeah, and so the genetic component is an interesting one. And I see this question asked a lot for people who especially are thinking of having children themselves, family planning. From what I understand, you sometimes will pass it down to your children, sometimes you won't. If you do, it might show through in different degrees, right? So it might be a very mild case, it might be an extreme case. Is that sort of what we know about it?
Yeah, that's true. It's not like mandatory that you will pass it on to your children. And as you said, you don't know the degree before, if they get it, how much it will be, or if it will, for some people it goes away with time. For some people it becomes worse. It's very hard to know. We don't have any way of knowing what will happen to any potential children to people with hyperhidrosis at the time.
That's interesting. So it can change over your lifespan
Yeah.
then. Yeah. Yeah, I've heard quite a number of people say that it's their hyperhidrosis, and I've experienced this myself, has sort of shifted. So when I was a teenager, it really bothered me in my underarms. Now it bothers me more in like my groin, my hands. So it's definitely shifted in how it displays itself.
Yeah. Yeah. And also when you talk about menopause and such, some people, it doesn't have to be that you get menopause really bad because you have hyperhidrosis, but in some cases it's like that, and then it's usually like more of the head with the hot flashes, and maybe the chest and the back, even if you didn't experience that as a teen or a child.
Gotcha.
Yeah.
Gotcha. Okay. And do we know how many people hyperhidrosis affects globally?
Yeah, I would say approximately 5% of the world population, but those numbers vary from like 1 to 10%, but I would say approximately 5 is what we say nowadays.
Yeah, I guess it's hard to know because it's so hidden, right? Like people
Yeah.
don't always self-report, and if there's not a lot of studies and funding given to it, then it's hard to fully understand.
Right.
Yeah. Okay. So switching gears then to talk about iontophoresis, can you describe in general terms how we think it works, or how the device works, and how we think that might impact sweating?
Yeah. So Iontophoresis is a medical device that it can be used in clinics or by the patient themselves in their own homes. The devices are usually like very small and compact, so it makes it easy, for home use. And what you do basically, if you're treating, the most common areas to treat are the hands, the feet, and the underarm area. And what you do is I think I have a couple of electrodes here from our device. So you take like the electrodes are inside these pockets, and for treating hands or feet, you place them in a water bin, and you pour like tap water into it, and then you connect with one cable each to the main device, and then you place your hands on the electrodes like this, one in each water bath, and then you run like a mild electrical current through this circuit, through your hands, through the skin. And you do that for approximately 20 minutes a day. Usually I recommend like daily use or every other day, like 1, 2, or 3 weeks. It's different for everyone. And then 90% of the cases you can see up to an like 80% sweat reduction. So it's quite effective. And then you have to do the maintenance treatments, which is usually also like 20 minutes once or twice per week. It looks different for everyone, to maintain the results that you have achieved. There are several theories like how this works. Some people think that it forms like some sort of block in the ducts of the sweat glands to prevent the sweat from coming out. But that, to me, that is like a more of an old theory. And there are some different theories about the electrical current affecting the nerve cells that are connected to the sweat glands. And I'm more into those theories. We haven't proved it's like that, but what they say is that, if you experience some sort of stimuli, it's hot outside, or you're moving fast, or you're really stressed, for example, that can make you sweat. And if you have hyperhidrosis, the threshold for starting to sweat is like really low. So your nerve cells are like really interested in producing this signal to the sweat glands. It can be like maybe just a few degrees outside. You're not even, moving fast. You might not even be stressed. Everyone with hyperhidrosis knows how it is, but still these signals from the nerve cells to the sweat glands, they come. So what we think is that with iontophoresis, it alters how the nerve cells function, so that they need more stimuli to create this signal. So basically, it will like raise the signal, the threshold of the signal. So you need like real heat or real stress or like moving fast to start sweating. So you become like more normal sweaty, like everyone else, basically.
Okay, so like in the majority of cases, it works, and in the majority of cases, it brings your sweat to a much more manageable level that feels more like a normal level.
Yeah.
Okay, interesting. And so what areas can it be used to treat? Now, I know that there's differences between what it's approved to treat in different countries and what it can treat.
Yeah. So all the research that has been done is basically done on hands and armpits. There are no like studies for the face or groin area or other areas. But I see no difference in treating like any body part except that you need to make sure that the electrodes are really tight towards the skin, which can be a problem with the face, for example, because everyone has a different shape of their face. So they, you need to make sure that the electrodes are really tight, fitting into the face. And that has been an issue in the market of iontophoresis devices. And something that we hope, with all our experience that we have, and now that we've become a legal manufacturer of devices and not just a distributor anymore, we hope to overcome that. So we're working on a design for a new face mask, hopefully, that can overcome the issues of the previous ones in the market. And then for the groin area, it's very similar to the armpits, and they often come together. When you sweat excessively, if you're in armpits, you often have it in the groin area as well. And the same goes for back and chest. If you're putting like one electrode here and one here, the current will pass in between them. So in the theory, it should work. But right now, it's more a matter of regulatory stuff, because you need to prove that it works, and to be able to prove that it works, you need to pay for studies to prove that it works. So as a legal manufacturer, my company cannot tell you to use something in other areas because it hasn't been approved. But like off the record, in my theory, I think that it works as long as the electrodes are like really wet and like really tight to the skin.
Right. Yeah. Yeah. Interesting. I'm sure that a lot of people listening will be happy to hear that there's work being done to try to find a solution for the face, because that is a really difficult area to sweat in. That is an area you can't hide like you can your arms, or, or your front or your back or your groin. So,
There's so much out there also, socially. It says a lot about the person if they have like sweat dripping down their face during a conversation.
Yeah.
It's just sending social cues, nonverbal social cues.
Yeah, 100%. Yeah. Okay. So now the biggest objection or thing I hear about iontophoresis is it didn't work for me. Are there typically reasons why that would happen, whether it's being used incorrectly, or are there actual like physiological reasons why it wouldn't work for some people?
Okay, iontophoresis hasn't been studied that much. The studies made, they are more like, does it work? Does it not work? Does it cause side effects? Does it not? Etc. So we don't know, as I said, even how it works. We know that for approximately about 10% of the population, it doesn't work, but we don't know why. What we do know is that the water seems to matter. And we don't know why. But we know that there has to be ions in the water for the treatment to work. So, for example, if you live in a place where you don't have a lot of ions in your water, like called soft water, there is recommendations to either like you add regular salt or you use mineral water, that can become a little bit expensive if you have to pay for the water. But that is what is recommended, because if the water is not right, iontophoresis will not work. Another thing that we do talk about is the amount of water used. Some people use like a lot of water, like maybe this high level of water, or they use very little water, like basically not even soaking the electrodes. And that can affect things a lot. Then also we talk about the current type. Most devices nowadays offer something called pulsed current, which is like the current takes small breaks, micro breaks, which is more comfortable, but then it delivers less energy. And that is, I would say, the best option for most patients. But in some cases, you need a constant current, which higher energy, not taking any breaks. So the amount of energy delivered, like in the current type, but also like how high the current is, how strong the current is, will affect. Different devices offer like different current levels, but it's very important that you don't use a too high current level, because if you do, you might get skin irritation or even like electrical burns. So you really need to watch yourself. Iontophoresis should not be painful, but at the same time, you have to go to the highest acceptable, tolerable level of current. So that is
Gotcha.
like one thing that people don't do. They maybe think it's scary, so they don't go high enough. Those are some of the reasons. And then also not performing the treatments often enough in the beginning, because it's quite, time consuming if you have to do it every day. But to give it a real shot, you should do it like every day for 2 to 3 weeks at least. And after that time, if you haven't seen the results and you tried all the settings, then it might not be for you.
Okay. So don't give up. Keep trying things. Try if you have a certain water source, like maybe you're on a well or maybe your city water is different, try different water, try the different settings, and yeah.
And give it some time, basically. I think some people just, in some cases, people give up too soon. But I will also like to say that if you have been doing this for months and months and it's not showing results, maybe it's time also to give up,
Right.
Because it should show results within a few weeks if it's working for you, if you're doing it right with the right settings.
Gotcha. Okay, that makes a lot of sense. That's really helpful. And what if you have cuts or any sort of injuries on your
Yeah, so when the skin barrier is broken somehow, like from a small wound or cut, that decreases the electrical resistance there. So all the current wants to go in to that spot. So you need to cover that spot like with a really thick layer of Vaseline, like centimeter thick, like this. Because otherwise it can be really painful and you can get like skin irritation or burns in that area, because all the current wants to go through there, because it's so, no resistance, just slide through. So I would recommend people with cuts, small cuts, to cover them, and then, increase the current slowly to see if it hurts. And if it hurts, abort the treatment and just wait until it heals.
You mentioned earlier that sometimes people are nervous to use iontophoresis devices. So, I mean, it sounds really counterintuitive, right? To like send an electrical current through the water, put your hands into it, right? So it makes sense that people are a little bit skeptical.
Yeah.
So assuming that somebody's using an approved device, made by a reputable manufacturer, what sort of safety elements are built in, or like how is it safe?
Yeah, it's first of all, these medical devices, they are so rigorously tested that they almost don't, pass and come out to the markets, because it's so hard to pass a medical device. And they have so many safety functions, like there are so many fuses and limitations. If anything is, not right, the current just cuts, it just stops. But also, what I want to encourage, the biggest risk with iontophoresis is people treating themselves with too high currents because they want the results so badly. And I would really like to say, don't do that, because then you can get the side effects, which is skin irritation or electrical burns at worst. So as long as it's comfortable, you're fine. And this is a device type that has been around for decades. So this is nothing new. So you can feel completely safe doing this. Don't worry. But I mean, even the sensation can be a little bit scary and, uncomfortable in the beginning, but it should never hurt.
Yeah. Okay. So people get really excited. They start on the max setting, and then they get skin irritation.
I can stand this. I can stand it just to become dry, and then they get like skin irritation, and they get, even small cuts, blisters, burns. and then they have to stop the treatments for weeks until it's healed, and don't
So
go
start
down that
slowly.
path. Yeah.
Start slowly, be patient, do it every day, increase slowly
Yes.
over time,
Patience
based on
is
what you can
key
tolerate.
here.
Yes.
Yeah.
Yeah. You will get there. Yeah.
Yeah.
Okay. Okay. And now I know there's a concern that, I don't know if this is a myth or not, but if you like lift one of your hands out while the treatment is on, you can get a shock as you're lifting your hand up. Is that true?
Yeah. So when you break the electrical circuit and remove your hand, the current has to go from whatever level it's at to 0. Otherwise, you can get it's, and we say shock, but we try to call it the electrical discharge, because shock is, quite a shocking word to use. But that can happen. It's a possibility. But as the devices get more and more modern nowadays, they get, faster at reacting instantly. So that is becoming less of an issue now with our modern devices than it was like maybe 10, 20 years ago.
Gotcha.
But
Gotcha.
it's not dangerous. If it should happen, it's not dangerous. It can just be a little bit scary.
Yeah. Okay. Okay. Okay, that makes sense. So now, when I found out that you were going to join me on my podcast, I asked the women in our Sweaty Girl Society community if they had any questions for you. And I got quite a great response, quite a lot of questions coming in. So I
Nice.
thought we could now go through some of those questions. Some of them I
Mm-hmm.
think you've answered in what you've already said, but I'll read through them and we'll see if you've got anything else to add to some of them. So the first question I got is, I tried iontophoresis as a kid in the 1980s and it didn't work for me at all. Does it just not work for some people, or has the technology gotten better? So you've already explained about why or why not it might not work for some people, but is there anything to do with the technology getting better over the last 40 years?
I think in many cases the technology is quite simple and it has been quite stable over the years. I think what has changed is, like, one thing, as I mentioned there, that they might be a little bit faster, so you don't get the shock that you used to get before in the same extent. And then also about the pulsating current, which wasn't a thing before. It makes it more comfortable. So then because of that, you can increase the current level without getting pain or side effects. So that can mean that more people can get help who couldn't before. And also, I would also like to say, as I said, with the water being very important, so it's hard to say which settings this woman used as a child, but I think she should give it, one more try to see, like, now as an adult, when she can do it, systematically, to see, is she using the right water, the right settings. Maybe she did it too seldom, which is a common thing if you do it in the clinic. They do
Yeah.
give you like one treatment and then it goes 1 week and they give another one. And that usually doesn't work very well for most people. So with home treatment, which has been a thing like maybe just 10 years or so,
Yeah.
the
Right.
results have improved, for more
Okay.
people are getting help with doing more frequent treatments in the beginning.
Yeah, and that was going to be my next question. How long have the at-home devices been available? Because I
Yeah.
remember when I was first diagnosed with hyperhidrosis at around age 20, my only option for iontophoresis was to go to a clinic and have a nurse administer it for me. And that seemed like a big deal, and they would do it twice a week. And yeah, so things have changed.
Twice a week is not so often, if you
No,
want the
it's
good
not.
results. So,
Yeah.
but it's often if you have to, go there. So it's
Yeah.
too often to go there, but it's too seldom to get the good results. So
Yeah,
not
exactly.
not the best way to do it, I think.
Yeah. Okay. Okay. The next question is, can you use it on your face or scalp? Which you've covered a bit, but the second part of the question is, I also have rosacea. So if I use it on my face, will it make my rosacea worse?
Yeah, so with rosacea, a lot of things can trigger that. For example, if you use like cortisone cream on your face, which is usually good for most skin conditions, but for rosacea it can be a trigger. And as most things with hyperhidrosis, this has not been studied, so we do not know anything about iontophoresis and rosacea. There is no study at all around this. But what I can say is if the skin is inflamed, irritated, or even the skin barrier is broken with small lesions on it, that's not going to be good for the treatment, because then you might get the side effects.
Mm-hmm.
And one other thing to know is that with iontophoresis, it increases the blood flow in the treated area, so it can give you a temporary redness of the skin. But I mean, it shouldn't affect rosacea like long term, but just so you know that like right after you might be more red. So if someone with rosacea was to try iontophoresis, I would recommend them to go like really, really slow and really low with the settings, and make sure that the skin is intact. You don't have any cuts before you go, to avoid the side effects.
Okay. That makes sense. The next question is there any risk of getting compensatory sweating elsewhere if you use it?
Yeah, so that is not so common. I mean, we don't have the exact numbers, but it's in my experience, it's quite uncommon, but it's not impossible. So every now and then I hear about someone, treating their armpits and getting it like more in the groin area. But that is like a temporary thing, because when you cease treatments, like with Botox, you can get compensatory sweating in other places. It's quite common with Botox, but when you cease the treatments, it usually goes away. And there is a hypothesis as well that when you lose your hyperhidrosis that you have been so focused on in one area of your body, then you might start focusing more on other body parts, and that you didn't even think about it if it was there before. So it might be that it increases, but it might also be that you focus more in other body parts as well. But this has not been so very well studied. But to summarize, I would say that the risk of compensatory sweating with iontophoresis is quite low.
Gotcha. And if it happens, it should resolve if you stop using the iontophoresis device. Do we know why compensatory sweating happens?
Yeah, we don't. It's quite interesting, because if you treat your hands, a lot of people will experience that their feet stop sweating. And a lot of people with hyperhidrosis, if they don't wear socks and the feet start sweating, the rest of the body will also start sweating. So there seems to be connections from the sweat glands between different areas. Like if one hand is really hot and starts sweating, the other one can go as well. Or we treat one with Botox or iontophoresis and the other one stops as well. But we don't know exactly what compensatory sweating is. Some people say that the sweat has to come out, but that is not true, because with Botox and iontophoresis, the sweat that was supposed to be produced is actually not produced at all, because the signal from the nerve cell to the sweat gland doesn't come. So it's not that you have sweat produced, going around in your body trying to get out somewhere.
It's not there. Yeah.
No, it's not there. But it seems like the signal. I mean, the nerve system is very plastic. It's very eager to change. So I think that if you're experiencing the stimuli and you treat with Botox, for example, in your hands, and then you do that for many years, and when you get the stimuli, the nerve cells, they grow and they change and they try to find, new paths to handle the stimuli that they are experiencing in some patients.
Okay. Yeah, that makes sense. Lots that we don't know, right?
A lot of things we don't know, unfortunately.
Okay, next question is, does the brand of the device matter, or are they all more or less the same?
Yeah, so I would say, to me, that iontophoresis is quite a simple technology, and it has stayed a lot the same during the years. I mean, as I mentioned, there were a few things that changed with the pulsating current coming into the devices, and then they becoming a little bit more fast, a little bit more modern, a bit more settings, but I would say it's quite the same. And as long as you have one that is safe, then I think they are quite the same. What you can look for is, for example, if you need, like, especially if you're treating your feet, if you need like really strong energy, like some people do, it doesn't necessarily have to do how much you sweat, but it just seems that some people need more energy, then they might need a constant current, especially for the feet. And not all devices have that. Most devices have the pulsating nowadays because it's more comfortable and gives less side effects. It doesn't irritate the skin as much. But look for a device that has both. That's a good way to go. And then automatic polarity shift, so you don't have to switch your cables by yourself. That's another good thing. What else is there? Yeah, to me, apart from that, they are, quite the same. You can also look for how high they go when it comes to current level, like milliamps and voltage, how high they can go. That can differ a little bit. But I mean, most people don't need the highest setting anyways. But it's just, it goes, especially if you're treating your feet, to think about how high the current and voltage goes for the device you're looking at.
Okay. And usually people need a higher milliamp on their feet. Is that because the skin is thicker, or?
Yeah, that is what we think.
Yeah.
that the skin is,
Right.
thicker, and but we don't know.
We don't know.
Once again, we don't know.
That would make sense, but yeah. Okay. Okay, cool. So next question is, if a woman has a copper IUD for birth control, is iontophoresis contraindicated? So can you use iontophoresis if you have a copper IUD?
Yeah. So when you talk about metal, then you talk about the path of the current. So the current doesn't, just go anywhere in your body. It flows through the shortest and least resistance path. So for example, if you're treating your hands, it's going to go from one hand through your arm, over your torso, through the other arm to your hand and to the water bath, and like that. So it's not going to go down to your groin area. It's not going to go up to your face if you wear dental braces or you have an IUD. So you can treat your armpits and your hands with a copper IUD, but you cannot treat your feet because then it will pass over the groin area. And it's theoretically, and I mean, there hasn't been many studies on this either. This is just safety precaution, is that theoretically is if the current passes through the metal, it can heat the metal, and the metal can then heat the surrounding tissue, and you don't have the sensory nerve cells around there, so you wouldn't even feel if the tissues would damage, most likely.
Yeah. Okay.
Internally. So that's, as a safety precaution, you should not have metal in the path of the current.
And if you have braces, you mentioned that's okay to use your hands, but you wouldn't want to do face iontophoresis on your face if you have braces.
Correct.
Okay, great. Well, the last question we have here is, I'd like to know what the long-term side effects are, if any.
From iontophoresis, you mean?
For iontophoresis,
so,
yes.
there has been very few and reported side effects when it comes to iontophoresis. That is skin irritation and electrical burns, and they are all short-term. In rare cases, there can be compensatory sweating as long as you're doing the treatment, but that is all. And that is one of the best things with iontophoresis. It has so few and so mild side effects. So no long-term side effects.
Is there anybody who shouldn't be using iontophoresis, or who should be particularly, concerned with talking about their doctor about using something like this?
Yeah. So you cannot use the device if you have metal in the path of the current, as we said. You cannot use it if you have a pacemaker, if you're pregnant, and it's always like that with pregnancy because no one wants to study a pregnant woman. So we don't know anything about it. It's okay to breastfeed in a period of life when you're doing iontophoresis treatment, of course, not at the same time as you're breastfeeding, but otherwise it's fine. Then there are some discussions. Then there are some thoughts about if you have some arrhythmia in your heart, if you have epilepsy, and if you have, for example, if you have any medical device attached to your body, like a pacemaker that you cannot remove. So those are the contraindications. And then if you have malignant conditions or sensory defects in the treatment area, because then, for example, if you don't have good sensory nerves in your hands, and you wouldn't feel if the current is too high, for example. So you have to be healthy in the treatment area, so to say.
Yeah. Okay. Cool. Well, that is all the questions that I have around iontophoresis for you. Is there anything else that you wanted to share about the devices?
Yeah, I want to say I think iontophoresis is a really great treatment for children as long as they are motivated for treatment. And that's one thing I always talk about when it comes to children and hyperhidrosis, is that because it's hereditary, some parents worry a lot when they notice sweaty hands in their babies. But I really want to send a message out there to parents. If you find your baby sweating a lot, please relax. That could be quite normal for babies. And, give it a few years when they become 5, 6, 7, 8 years old, and, be open and see if they start, talking about it, complaining themselves, and, be there, because it could be very shameful, and go from there. But because they sweat as babies doesn't mean that they, their whole lives will be ruined because of the sweating. So try to stay calm. But if they do want treatment, iontophoresis is a really good option for children, as I said, because it's not painful. It just takes the time. It needs to stay motivated. Motivation, the patience is very important for iontophoresis to work.
Right. Yeah. That's a good time to maybe put a show on while they're doing the treatment.
Yeah.
Yeah. Okay. Amazing. So, can you tell me a little bit more about Hidroxa? Are you a manufacturer? Are you a distributor? Can you tell me a little bit more about your devices?
Yeah, sure. As I said, we started off as distributors for this German device, but then there are a lot of things in Europe changing regarding regulatory stuff. It's becoming more and more, advanced and more, higher demands to keep the safety up. So the old device that we were selling is not going to be, recertified towards those new rules. So we had to decide, like, are we staying here? Or are we jumping off this when this device disappears in a few years? So we decided to go for it and create our own device. And we knew that we had a lot of experience from, working with devices, and me working in the sweat clinic. We had the full understanding of the hyperhidrosis patients, what they were looking for, and also what people struggle with when it comes to iontophoresis. So we try to build our own device and, incorporate all that we have learned about iontophoresis in this, last almost decade. And that led us to the Hidroxa SE30, which is the new device that is FDA cleared, but now also CE marked for Europe. We are very happy now to have become a legal manufacturer of iontophoresis devices now.
That's amazing. Congratulations on that. Now, if people want to learn more about Hidroxa, the iontophoresis devices that you sell, how they can get their hands on one, where should they go to learn more?
Yeah. So we have a web page. It's www.hidroxa.com. We try to, not only sell the devices, but also we try to raise a lot of awareness. So we have some articles about, hyperhidrosis in general, and then about iontophoresis in general, and then of course about our device. And then I am on social media on Instagram. I'm Dr. Sandra Hyperhidrosis on Instagram. And then we have the Hidroxa account on Instagram as well. And we, try to make also not just, clips about the device, but once again, things that you can relate to, trying to, build a community and be something that I was looking for at that age. Try to make people feel less alone, basically.
Yeah, I love that. I love that. Well, thank you, Dr. Sandra. Thanks for your time today. I think this is going to be really helpful for a lot of women listening who maybe have tried it in the past, maybe are considering it, and have questions. So thank you so much.
Thank you for having me. It was really nice.
Thanks for listening to the Sweaty Girl Society podcast. If you liked today's episode, join our free membership community at sweatygirlsociety.com/community.